So, hi, my name is Maya. I'm a nursing student from Southwest Tech. I have an order today to do a full body assessment since you're a new patient. I'm going to provide privacy. Um, can you tell me your name and your date of birth?
Hunter Kisting, February 12th, 98.
Okay, and do you have any allergies?
Nope.
Okay, just going to verify that with your wristband. Perfect. And I have my doctor's order. And I'm going to wash my hands. And if I needed gloves, I'll put them on, but I don't. So, okay, there's my first aid. So I'm going to start out by looking at your eyes. So I'm going to kind of look at your eyebrows, your eyelids, and your eyelash, and everything looks really good. Can you pull down your... Okay, that looks good. And pull it up. Perfect. You can see. There. So good, they can see that. So then I'm going to look at your pupils. Okay. Pupillary response is good. I'm going to have you look at this pen. Look at the wall. And look back at the pen. Perfect. Awesome. That looks great. I'm going to have you follow my pen. So, 1. And down at your nose. Perfect. So I'm going to have you tell me when you see my pen, okay?
No. 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 And no.
Perfect. Okay. So I'm going to ask you some questions about your eyes. Do you wear glasses?
Yes.
Have you ever had any eye surgery or eye trauma?
Nope.
Okay, and does your family have a history of eye problems?
Nope.
Perfect, great. So, eyes, we're going to move on. Oh, I'm going to have you read something.
I have a birthday card over here. 2013 Focus Owner's Manual.
Great. So, I want you to remember that. So then I'm going to go down to your ears. Okay? So just kind of ask you some questions. Do you have any, have you ever had any problems hearing?
Nope.
Have you ever had tubes in your ears or?
Nope.
Okay, and does your family have a history of hearing problems?
Nope.
Okay, great. So I'm going to look into your ears with my otoscope. And I see a nice pearly tympanic membrane on this side. And same goes for this side. I'm going to kind of move your pinna, your auricles, and your tragus, and I'll feel your mastoid process. Does any of that hurt?
Nope.
Great. So I'm going to go behind you. Now I want you to tell me what side you hear this on. Perfect. Okay. So that should be it for ears. So I'm gonna look at your nose and your mouth, okay?
Okay.
So first off, I'm gonna feel your sinuses. Does any of that hurt?
Nope.
Great. So let's kind of looking at your nose. Everything looks nice. The color's really even. I don't see any like discharge or anything. Doesn't look like you have a deviated septum. Can you breathe in? Perfect. So all it looks really good. Your nose looks great, and your lips look good. Can you pull them down for me? And pull them up. Great. And then can you show me your teeth and your gums? Awesome. Your teeth and gums look great. Can you open your mouth for me? All right. And your tonsil and everything back there looks good. Can you stick out your tongue? Great. So then I'm going to feel your throat. Can you swallow?
Yep.
Very good. Okay, so now I got your mouth and your gums all done. I'm going to feel your lymph nodes. So I have your occipital, your preauricular, your postauricular, your precervical, your postcervical, your submandibular, your submental, and then your supraclavicle. And all that's good. So then I'm going to move on to your skin and muscle assessment, okay? So I'm gonna kind of start out by just kind of see everything right. Okay. So I'm gonna start out by kind of feeling your skin. It's dry, it's warm, it's the right color. Everything looks really good. I'm going to kind of feeling for like edema or phlebitis. Edema is like a swelling of the skin. There isn't any. If there was, I would kind of move up the leg and then move the scale from 0 to 4, 0 being none, 4 being the worst. Like pitting edema, your skin wouldn't go back to normal. And then phlebitis is like a swelling and a redness of the veins, which you don't have any of that, which is great. You look at your hands. So your nails all look really good. Your capillary refill's good. Down here, that's really good too. So I'm going to have you stick your arms out. Doesn't look like there's any tremors, contractures, or fistulations, which is great. I'm going to feel your joints. I want you to tell me if any of this hurts, okay? Anything? No, great. Okay. So then I'm going to do your muscles and your range of motion. I'm going to do your sternocleidomastoid. Can you push? Push. Shrug. Great. And can you put your arms up? Push your arms up. Great. That's your sternocleidomastoid, your trapezius, and your deltoids. I want you to make a fist. I want you to pull. I want you to push. It's your bicep and your triceps. I want you to push and pull. And that's your wrist muscles. And I don't want you to let me pull your fingers in. Great. Awesome. Strength. And I want you to grip my fingers. Great grip strength. Nice and even. Okay. So that's like your wrist, your finger, your grip strength. Now I'm going to push your legs in. Don't let me. Okay, don't let me push them out. That's your abductor and your abducens muscles. Don't let me pull your legs. Don't let me push them. That's your quads and your hamstrings. Don't let me push your feet down. Don't let me pull them up. Great, and that's your ankle and your feet muscles, all of which work really well. Do your muscles. Okay, and before I forget, I'm going to do your skin trigger, which is up here. All right, you have great skin trigger. You're nice and hydrated, which is a really good sign. Someone your age should not have bad skin trigger. All right, so then I'm going to have you stand up. And I'm going to have you bend over. Camera can see. Looking at her spine, she is really good. Spine symmetry, there's no signs of scoliosis. You can stand up. And then also no signs of kyphosis or lordosis. I'm going to have you take a few steps.
Can we walk that way or that way?
You can walk that way. Okay.
I'm just clumsy. I'm not sick.
Alright, besides being clumsy, you have really good gait. And then I'm going to have you stand still. Close your eyes. Okay. Doing the Romberg test, you're nice and even. You can open your eyes. There's no unnecessary swaying. Like if you had a stroke, we kind of worry about that. But you're nice and healthy. So now that I've done all that, I think my muscular test is done. You can go ahead and sit. Okay, so then, can you tell me what day of the week it is?
It is a Wednesday.
Great. And who's the president?
It is Trump.
Unfortunately, right?
Right.
It's okay. Everyone makes a joke when we do the video. So, location and memory. Okay, so I'm going to go through the 12 kind of cranial nerves. So, it's going to take me a little bit. So, I did olfactory. I'm gonna have you smell this.
Smells refreshingly minty,
Great.
like a mint chapstick.
Awesome.
Alright.
Alright, so olfactory. Optic, I had you read that line. Ocular motor, I had you move your eyes around.
Right.
So trigeminal, I had, can you close your eyes? Tell me where you feel this.
Cheeks, forehead, nose, and chin.
Great. And trochlear, I had you looking at your nose, remember? So, okay. And then I did acoustic by having you hear my fingers before. And facial, can you puff your cheeks out? Great. And can you smile? Great. So I'm make sure I found a. Can you say ah?
Ah.
Okay, glossopharyngeal. Can you swallow? Great. Probably getting sick of me having you do that, huh? Gross swallow more. Can you shrug for me? Great. And say ah.
Ah.
And move your tongue around.
Ah.
Great. So that's all the 12 cranial nerves. Good job. So then, should be good for cranial nerves, I think. So, moving on to respiratory. I'm going to ask you some questions. I'm going to ask you your respiratory and cardiac questions now just to get them out of the way so I don't forget. So for respiratory, do you smoke?
Yes.
Yes. Do you really have any problems breathing at all?
Nope.
Do you have a family history of like lung cancer or other issues like that? Okay. And then for cardiac, have you ever been diagnosed with like a heart murmur, like a bundle blockage?
Nope.
Great. Does it ever feel like your heart's beating like really fast?
Nope.
All right. And does you have a family history of heart problems?
Nope.
Great. Okay. So now that's out of the way. I'm going to kind of do your AP ratio, which is 1 to 2, which is great, or 2 to 1, however you really want to say it. Anyway, it just means you're not barrel chested. I'm going to feel your anterior thorax and your posterior thorax. Everything feels good. There's no like crepitus or any like popping, bubbling. So that's good. I'm going to have you breathe in. Great, your chest exertion is good. And then I'm going to listen back here. Normally I would have you breathe in and out for every time I move my stethoscope, but I'm not going to have you do that because you would hyperventilate. Anyway, I'm going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. And I'm going to do the same on the front. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Everything's really good. They're just kind of looking at you. It doesn't look like you're having any trouble breathing at all, which is really good. I'm going to listen to your carotid while you take a deep breath for me. Great. Perfect. And then that should be it for respiratory. So I'm going to move on to cardiac. So I asked you my 3 questions. I'm going to listen again. I want you to hold your breath this time. There we go. Perfect. So then got that done. Just kind of looking at you. I don't see any pulsations or anything. So then I'm going to go ahead and listen to your your aortic and your pulmonic. So okay, your Erb's point. And then your mitral and tricuspids. Great. And so you're going to hear your S1 and S2 sounds. You're going to hear your S2 sounds up here and your S1s down here. It's just kind of the lub-dub differential. And then your Erb's point, you're going to hear them the same. Okay. So then I'm going to kind of go over your pulse points. So there's temporal, carotid, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. So it's all good for that. And gotta make sure I got everything for that. Alright, so that should be good for cardiac. Alright, so I'm going to have you go over here. Okay, so it's not kind of letting me, we're going to try to do it from here. Probably feels a little messy.
Yeah. My bad.
That's alright. So, having you lay down here, okay. Oh, I gotta remember to finish your neurological assessment when we get back up. So, I'm actually gonna have you sit up, so don't forget to do that.
Thank you.
Great. So I'm gonna have you do the fingers to nose test. Great. And then grabbing your foot, I'm just gonna kind of lift it up. And while it's ticklish, you don't have the Babinski reflex, which would be like kind of like a expansion of like your toes, and you shouldn't have that after a few months after being born. So awesome, you can lay back down. Oh. All right. So then, having you lay down here and just kind of looking at your stomach, I don't see any like distension or like hardness. It doesn't look. I'm gonna have you lift your head up. Great. And while I'm down here, and while you're laying down, we're going to look at your jugular vein distension from your cardiac. And I don't see any, which would be like you're having you lie flat. I would take these pillows out, and then if I did see any, I would lift you up to 45 degrees, and if it didn't go away, I would talk to a doctor because it should go away after that. But you don't have any, so that's great. So now I'm going to listen to your bowel sounds in each quadrant for 5 to 15 seconds each, but for the sake of the video, I'm going to keep it short. So here, you can kind of see it in here. So once I did that, I'm going to flip this over, and I'm going to listen to your arteries. So femoral, iliac, renal, aortic, and then the same on this side. Great. So then once I'm done kind of listening to your stomach, I'm going to percuss. Once I'm done percussing, I'm going to palpate. Just kind of like putting my fingers across. Okay, it feels normal. There's no like hard masses. And if you were ticklish, I would do it kind of slower with like more of my hand. Okay, and I'm just going to kind of run everything over so I make sure I didn't forget anything. Before I had you do this, of course, I'd have you lay down, I'd have you void, and then I'd lift your feet up, like they are now. If you're a practice individual, you know what's going on. Alright, and I already did all your muscles. Good. Alright, so I think that's good. Is there anything else I can get you on here? I have time.
Nope, I'm all good. Thank you very much, Nurse Maya.
Awesome.